Thank you, Mr. Speaker. The pipeline is crucial to this government and to this province, but at the same time, properly investing in healthcare, equally the same in allied healthcare, will also do the same for our bottom line. I had a constituent that wrote to me, being a pharmacist for the past 17 years, she wrote to me to express her concern about the changes to pharmacy funding and how that would affect her treatment that she can offer. She mentioned that one patient said that without her help in smoking cessation, he would have just kept smoking and gone on and given up. To the Minister of Health, have you heard from pharmacists who are concerned about your budget cuts and how that will result in fewer smoking cessation sessions and create greater health care costs?
Honourable Minister of Health.
Thank you very much, Mr. Speaker. We certainly appreciate the role pharmacists have in supporting the healthcare needs of Albertans throughout our province. Under this new framework, Alberta pharmacists continue to be compensated at rates higher than their counterparts in other provinces. Let's be clear, the only ones proposing cuts to healthcare are the members on the other side of this House, Mr. Speaker. On this side of the House, we're standing up with frontline workers, we're standing up with frontline Albertans, and we're making sure that we have sustainable growth so they get the healthcare that they need. We'll see what you do when we bring forward our budget for approval in a couple of weeks, Mr. Speaker.
First supplemental.
Mr. Speaker, this minister is the one who just cut pharmacies by $150 million. The same pharmacist helped a man that was on antidepressant and anti-anxiety medication slowly reduce and taper off his use. The man had started the medication after losing his wife, and he thought he'd have to take him for the rest of his life. After working through the reduction plan with his pharmacist, he asked, "Why hasn't a doctor shown me this before?" To the same minister, have you heard from pharmacists who are concerned about your budget cuts will result in less responsive treatment for patients?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. Again, we sat down with the Alberta Pharmacists Association, RXA, and worked with them on a tool that helps us achieve savings year over year. But you know what, Mr. Speaker, we're increasing the pharmacy budget by 4.3% because we know that that's important in this province. Instead of proposing deep ideological cuts, I think some members of the opposition talked to about 5% across the board. On this side of the House, we're working in a strategic way to keep patients at the focus. A 4.3% increase to pharmacy to keep up with growth and increased needs, Mr. Speaker, that's a responsible thing to do, and I suspect that members opposite will hopefully join us in supporting our budget.
Minister, second supplemental.
Mr. Speaker, the minister cut frontline staff pharmacists by $150 million. And pharmacists are planning another rally this week to make their concerns heard about these budget cuts. Like community pharmacists who wrote to me said they're concerned about the level of care that they'll be able to provide their patients, and the patients will suffer because of it. They're also concerned that those cuts were made without their knowledge or consent. If you haven't heard from these concerned pharmacists, will you be at that rally? Would you take the time, listen to them, and work out a plan that's going to help better patient care?
The Honourable Minister.
Mr. Speaker, I'm proud of the fact that during difficult economic times, on this side of the House, we decided to protect healthcare. We brought forward a 4.3% increase to pharmacy services. And, Mr. Speaker, it was important to us that those go towards the front lines, ensuring that patients have access to more pharmaceutical coverage, smaller co-pays, and other opportunities, Mr. Speaker. And what is true is that we have a 4.3% increase to that line item, Mr. Speaker. We want it to be focused on patients, and we want it to ensure that we get the best outcomes. And I'm proud that the RXA sat down with us at the table and helped us reach this reasonable compromise and position, Mr. Speaker.